Have you ever wondered why the mind plays such a crucial role in sexual arousal? It's a fascinating journey from the mind to the physical response, and sometimes the journey doesn't go as planned. This can result in erectile dysfunction, or ED, a condition that affects many men worldwide. The mind is the starting point for an erection. Sexual arousal ignites nerve cells in the brain, sending signals to the body on how to respond. But what happens if the mind fails to trigger these signals? This can occur due to relationship issues or psychological trauma, leading to ED. Stress, depression, and anxiety are well-known culprits that can hinder a man's ability to achieve and maintain an erection. Even taking antidepressant medications can contribute to ED. There's compelling evidence that men who exhibit symptoms of depression are more likely to experience ED, with severity levels correlating between the two. But the relationship between depression and ED can be a two-way street. Men who report having ED are at a higher risk of developing depression compared to men who don't. Overcoming these psychological barriers that lead to ED involves several approaches, heavily dependent on individual circumstances. If you're battling stress, anxiety, or depression, seeking help from a healthcare professional is a good starting point. In some cases, ED might stem from sexual trauma or religious beliefs, requiring therapy to resolve. In situations where performance anxiety or lack of confidence in a new relationship is the issue, ED medication might be recommended. It's important to note that ED treatment doesn't necessarily need to be taken regularly, but can help some men regain lost confidence. However, if psychological issues aren't the root cause of your ED, it might be physiological, leading us to the next crucial function for an erection: nerve signaling. The central nervous system, rooted in the brain, controls nerve signaling. It signals the body to relax the arteries, increasing blood flow to the penis. But if there are issues with the nerves, perhaps due to injury, surgery, or certain diseases, ED can occur. Blood flow is another vital component for a robust erectile function. When the central nervous system triggers an involuntary physiological response during sexual arousal, arteries relax and widen, increasing blood flow to the penis, resulting in an erection. Many ED medications like sildenafil or Viagra are PDE5 inhibitors. These prevent the arteries from narrowing, encouraging longer, more satisfying erections. However, if blood flow is the issue, it could be due to underlying problems like diabetes, high cholesterol levels, or smoking. Lastly, hormonal imbalances can also cause ED. Low levels of testosterone, which plays a pivotal role in libido, or abnormal thyroid hormone levels, can lead to ED. In essence, the journey from the mind to the body for an erection is complex and multifaceted. Understanding this journey helps us to better comprehend and tackle ED, a condition that can impact a man's life significantly, but is not insurmountable.